Dear Marci, I didn't enroll in Medicare when I turned 65 because I was still working and covered by my employer's health insurance. Now I'm retiring at age 67 and have missed my initial enrollment period. How do I enroll? Loretta, Tampa, Florida. Dear Loretta, you can enroll in Medicare using a special enrollment period, SEP. SEPs are periods of time outside normal enrollment periods where you can enroll in health insurance. They are typically triggered by specific circumstances. There is an SEP that begins when you have coverage from current work, job-based insurance, and you are in your first month of eligibility for Part B. It ends 8 months after you lose coverage from current employment because the employment or insurance ends. Using this Part B SEP also means you will not have to pay a Part B late enrollment penalty, LEP. To use this Part B SEP, you must meet two criteria. One, you must have insurance from current work, from your job, your spouse's job, or sometime a family member's job, or have had such insurance within the past 8 months. Two, and you must have been continuously covered by job-based insurance or Medicare Part B since becoming eligible for Medicare, including the first month you became eligible for Medicare. Note, you can have no more than 8 consecutive months without coverage from either Medicare or insurance from current work. You are ineligible for the Part B SEP after going for more than 8 months without Part B or job-based insurance. In most cases, you should enroll in Medicare before losing job-based insurance to avoid gaps in coverage. Remember, even if you use the SEP to avoid a late enrollment penalty, you may still be responsible for any health care costs you incur in the months after losing job-based coverage before your Medicare coverage takes effect. For help timing your Medicare enrollment to ensure it starts immediately after you no longer have job-based insurance, reach out to your Human Resources Department 1 to 2 months in advance. If you are considering delaying Part B enrollment because you have job-based insurance, make sure to learn whether your coverage will be primary or secondary. Note, beginning in 2023, you may also qualify to use an SEP to enroll in Medicare if you meet certain requirements, such as if you mistakenly delayed Medicare enrollment based on employer misinformation. Congratulations on your retirement, Marci. Dear Marci, my dad is 67 and was released from prison at the beginning of February. He didn't enroll in Medicare when he turned 65 while he was incarcerated. So now he is back home and without health insurance. How should he enroll in Medicare now? Will he owe a late enrollment penalty? Abigail, Fort Wayne, Indiana. Dear Abigail, it is usually best if someone enrolls in Medicare when they are first eligible. As you mentioned, many people who delay enrolling in Medicare must wait for the general enrollment period and then may owe a late enrollment penalty for life. Beginning this year, though, 2023, if someone misses a first-time enrollment period, there are certain situations when they might qualify for an exceptional circumstances special enrollment period, SCP. One of these new SEPs is for people who were released from the custody of a penal authority, including a prison, after January 1st, 2023. To be eligible for this SEP, your father would have to be eligible for Medicare, have failed to enroll in Medicare while he was incarcerated, be released on or after January 1st, 2023. Note that Medicare defines incarcerated as individuals who are in the custody of certain authorities, including people under arrest, imprisoned, residing in halfway houses, living under home detention, or confined completely or partially in any way under a penal statute or rule. If he is eligible, the SEP lasts for 12 months. The SEP starts the day he was released. The SEP ends the last day of the 12th month after his release. He can choose to have his coverage begin on the first of the month after he signs up, or to have it begin up to 6 months retroactively, but not before January 1st, 2023, or before his release. If he uses his SEP to enroll in Medicare, he will not owe a late enrollment penalty. To use this SEP, your father should contact SSA. If your father then wants to enroll in a Medicare Advantage plan or standalone Part D prescription drug plan, he should contact 1-800-Medicare. That number is 1-800-633-4227 to learn more about his enrollment period options. He may qualify for a Medicare Advantage or Part D SEP or have other enrollment periods available depending on when he enrolls in Part B. Best of luck to him as he enrolls in Medicare. Marci. Dear Marci, I'm in the hospital after surgery and I am getting ready to go home. I think it will be difficult to get around or leave my house for appointments and physical therapy, though. Will Medicare cover physical therapy in my home? Wallace, Buffalo, New York. Well, actually, Buffalo, Wyoming. Dear Wallace, yes, Medicare covers home health care if you qualify. Medicare can cover the following home health services: skilled nursing services such as injections, tube feedings, catheter changes, observation and assessment of your condition, and wound care. Provided up to 7 days per week for generally no more than 8 hours per day and 28 hours per week. Skilled therapy services such as physical therapy, speech language pathology, and occupational therapy. Home health aide who provides personal care services like bathing, toileting, and dressing. Note, Medicare pays in full for an aide if you require skilled care. Medicare will not pay for an aide if you only require personal care and do not need skilled care. Medical social services such as counseling or help finding resources in your community. Medical social services are ordered by your doctor to help with social and emotional concerns you have related to your illness. Medical supplies such as wound dressings and catheters. Durable medical equipment, also known as DME, such as wheelchairs and walkers. There are certain requirements you must meet to be eligible for the home health benefit. For example, you must be considered homebound and have a plan of care approved by your doctor. It is also important to know that your home health care is covered by Medicare, even if your condition is chronic or if you are not showing signs of improvement. Speak with your doctor or hospital discharge planner to begin home health care. If you need home health care, it should be included as part of your hospital discharge plan. If you have original Medicare, call 1-800-Medicare or visit www.medicare.gov/care-compare to find a list of Medicare certified home health agencies, HHAs. If you have a Medicare Advantage plan, you should contact the plan directly for a list of HHAs in your plan's network. Marci.